right, thank you very much, Chris. Well, it's not just celebrities who are getting plastic surgery. The average person is also experimenting in plastic surgery. Dr. Christian Prada from the St. Louis Cosmetic Surgery Center is here, and we're going to talk about a bunch of different things, but first we're going to start out by talking before undergoing cosmetic surgery. There's some things you need to know. Thank you for joining us.
Thank you. Thanks for having me. Well, I think the important thing is to do as much research as you can before you go in and see your cosmetic surgeon. These are things you can pretty much find relatively easily on the website.
Right.
If you go, you want to make sure that you find out if he's board certified. If you have a surgeon in mind that you're thinking of seeing, you can easily go to the American Board of Plastic Surgery website or the American Society of Plastic Surgery website, type in his name and they'll tell you if he's board certified, okay?
And what about for those, what expectations, what can you tell us about the expectations before going into surgery?
Well, I think it's always important to make sure that the patient has realistic expectations and to realize that there are many factors that go into determining the final outcome of the patient. One of them is the surgeon you're going to, once again, the qualifications of the surgeon, the techniques that they're using, obviously. Hopefully they're going to be the most up-to-date techniques. And then you want to sit there and make sure that the patient is obviously compliant in the post-operative care. If you tell a patient to not smoke after having abdominoplasty and they decide to smoke, obviously that's going to affect the outcome. And then lastly, it's what the patient starts with. If the patient starts with something and they're hoping to have something else, you may not be able to achieve that in a realistic means. So they have to be pretty realistic about that.
And you also have to be pretty much prepared because some of it's expensive and then you have the recovery. Talk about all that.
Well, I think it's important for the patients to know that this is not covered by insurance, and there are some patients that come in and do ask that. So financially, you do have to be prepared for a cost that can be anywhere between $4,000 and $25,000. In terms of the recovery, again, you want to ask your doctor how long is it going to be before I can go back to work, how long is it going to be before I can exercise, because these are things that obviously can limit your time frame in terms of, can you have it done in the spring or in the summer or in the fall. And so that's going to be something you're definitely going to want to ask them.
And there are also some psychological changes you should be aware of, right?
Yeah,
Possibly.
I mean, as plastic surgeons, we have to do a little what we call mini mental status exam. We want to make sure that the patients who are having the surgery are doing it really for the right reasons. You don't want to have a patient that comes in and has surgery after a divorce or a major breakup or something. But in most cases, I think the benefit is that cosmetic surgery really does improve the psychological feelings of the patients, and I think they tend to feel a lot more confident about themselves.
What would you say are some of the popular non-invasive procedures?
Well, I think it's amazing that over 9.5 million people last year underwent minimally invasive procedures, and these include Botox, collagen fillers, regular fillers that they have, laser resurfacing, chemical peels, and so these are a lot of the treatments that we can do that aren't quite as aggressive as surgical procedures, but really can help bridge that time frame between maybe when you need that and where you are today.
And you brought some examples here for us, Dr. Prada. So
yeah, I mean, we brought some examples of some what we call medical grade skin products here, and this is a little different than what you can get if you just go to a store because it has sometimes a little bit stronger medication in there that can help prevent wrinkles, that are just good to basically help with sunspots and aging. And then we brought in a couple of implants here, and these are the two.
These are very popular, aren't they?
Yeah, there were over 300,000 augmentations performed last year, so this is still the most popular cosmetic surgery that's done today.
What's the difference between these? I know this is silicone and this is saline. So what's the difference, would you say?
Well, the difference, I'd say, or the benefits to the silicone gel are essentially they tend to look and feel a little bit more natural. There's still a lot of people who come in and they're very worried about gel, worried about leaking and a lot of the history behind it. But the FDA in 2006 reapproved this implant for use, and nowadays, at least in my practice, it encompasses about 90% of what patients choose.
And for folks who are thinking about an invasive or non-invasive procedure, how do they get in touch with you?
Well, if they're interested, they can either go to our website, which is www.stlouiscosmeticsurgery.com or stlcosmeticsurgery.com, or they can call our office at 636-530-6161.
Anything else you want to add for the folks who may be considering something out there?
All I would say is just make sure that you're, if you're interested, that you look for a board-certified plastic surgeon, and that would be something you can find on the American Society of Plastic Surgery website.
All right. Thank you, Dr. Prada, for joining us. Now we're going to send it back into you, Elliot.
All right.